If we look at some more standard dose vitamin K2 trials, so at doses that we could access in a pharmacy or a supplement store, the results again are a little bit conflicting, but this meta-analysis that came out last year suggested that K2 improved bone density without necessarily having a clear improvement in fracture risk. There were improvement in bone health markers, and the effect sizes were more pronounced in people with the worst osteoporosis. So if you were older or more frail or had worse bones, you were probably more likely to benefit than someone that had just some mild osteopenia, which is a milder version of osteoporosis. There are also some regional differences, which is quite odd. So the Japanese trials always seem to look a little bit better, and then when the Europeans tried to emulate that data, the results weren't quite as good. So that does raise the possibility that maybe there's a genetic difference in Japanese people that means they benefit more, or maybe their regional diets just happen to be a bit more deficient. But to sum up K2, it's safe, it's cheap, it's potentially effective, and it's particularly useful for high-risk osteoporosis and postmenopausal women. It also carries some non-bone benefits, especially for heart disease, so a lot of our patients will end up on it for that reason. Our practice is generally to increase K2 in foods as a priority, but combining it with vitamin D and or calcium for higher risk patients is not unreasonable. Potassium is another bone constituent that often gets neglected, and higher potassium intake is associated with lower osteoporosis risk. In fact, there's a couple of recent studies done where they took a bunch of people and just gave them 50 grams of prunes a day, and that actually improved their bone density quite significantly, which was primarily put down to the potassium content of the prunes. Now, obviously the prunes have some carbohydrate in them, so they're not going to be appropriate for everyone, but there are some people who will be able to tolerate that carbohydrate content. Failing that, getting more potassium in our foods or in salts or electrolyte solutions is a common practice for our patients as well. Somewhat linked to potassium is magnesium, which not only supports potassium but also calcium metabolism. Magnesium also independently supports osteoblast function, so helps them lay down new bone. And observational studies link higher magnesium intake with higher hip bone density. In fact, the magnesium content of our drinking water actually correlates very well with fracture risk, and the magnesium content of our water varies quite a bit across the country, unfortunately. There aren't enough good long-term studies on magnesium supplements, but short-term studies show that you actually improve your hip bone density with just a simple magnesium supplement, so that's quite useful. And similar to K2, it's worth noting that dietary magnesium deficiency is very common. Our soil is becoming quite deficient in magnesium, so a lot of our patients do feel better when they take a magnesium supplement. So perhaps rather than looking at all of these ingredients in isolation, we need to be thinking about a more unified strategy if we want to maximise our bone building potential. And so several times through that data, you'll see that when we use something in isolation, it doesn't seem to be that good, but maybe if we combine them together, that's when we can build bone more effectively. And that kind of makes sense, because to build bone, you probably need appropriate building blocks of all of these things. But what about protein? As I mentioned before, the bone collagen scaffold makes up a significant portion of our bone weight. And in fact, protein intake actually also modulates calcium absorption in the gut, which is incredibly helpful. And low protein diets are associated with higher bone breakdown and increased risk of not just osteoporosis, but fracture in the long term. And if we just look at studies of a classic low protein diet, which would be the vegan or plant-based diet, we can see just how bad it can get if we neglect dietary protein. So there's several systematic reviews showing that avoiding animal products significantly increases your risk of osteoporosis and fracture risk in the long term. Even if we ignore the source of the protein, be it animal or vegetable, higher protein diets are associated with lower hip fracture risk, with the optimal protein intake being more in the vicinity of 1.2 grams per kilogram per day. And this really suggests that the current recommended protein intake of 0.8 milligrams per kilogram per day is grossly inadequate, especially for older patients who already have higher protein needs.